Welcome back to TV5 News at 9, everyone. It's time now for Medical Moments with Covenant Healthcare. Joining us this morning, we have cardiologist Dr. Amr Kadri. Dr. Kadri, thanks for being here.
Oh, thanks for having me. Appreciate it.
Of course. So we're going to start off, of course, talking a little bit about atrial fibrillation, or AFib, for those who know it by that. Why does it increase the risk of stroke? What is this?
So the atrial fibrillation is an abnormal rhythm or abnormal heartbeat when the upper two chambers of the heart they do not contract as they should. That results in having the blood to be stagnant or to pool in the left atrium, specifically in a pouch in the left atrium. We call it the left atrial appendage. So that small pouch will have the blood pool in there, and it's kind of stagnant. Then with low flow there, you may end up with a clot. And if that clot breaks loose into the brain, you may end up with a stroke.
Okay, yeah, definitely don't want that.
No.
Can you tell us if there's a procedure that's effective in reducing the risk of stroke caused by AFib?
Correct. So let me come back to that AFib. So for patients who are having high risk of having strokes, we tend to give them blood thinners. Now, some of these patients, we may not be able to take blood thinners because of frequent falls, or they are bleeding profusely, or they have low hemoglobin, or just the blood thinner is not suitable for them.
Right.
We need another alternative approach to prevent clots from forming. So there is a procedure, we call it the left atrial appendage occlusion procedure, that we go from the groin. We don't crack the chest open or anything. And then we go to the heart through the veins, and then we go to the left atrial appendage. We take a picture, we take measurements, and then we pick the suitable plug or seal for it, and then we deploy it and come out. Procedure itself takes less than an hour. It's minimally invasive. Patients, tolerate it very well. They'll be able to walk in like few hours to the bathroom and everything. Most of the patient will go home following day. Recovery is pretty much easy. They go do their daily routine activities in a couple, 3 days afterwards.
Very good. What type of candidate is good for that type of procedure?
Again, some patients who cannot take blood thinners and they are at high risk of having a stroke with AFib. Patients who falls a lot, patients with bleeding, GI bleeding, bleeding in the stool. So these kind of patients, that would be the great candidate for the procedure.
Can you tell us the success rate of this procedure and also the risks that come with it?
Sure. Success rate is like above 95–98% of the patients, will have the procedure successfully, done. Risk of the procedure, by the end of the day, this is still an invasive procedure. It comes with its own risk. Some patients may bleed in the groin. Minority of patients, or rarely, you may have bleeding around the heart, or needing for open heart surgery, or even end up with a stroke, unfortunately. The complication rate are rare, but it's there.
Okay. And I guess also you had mentioned kind of patients afterwards could go to the bathroom maybe a few hours later, leave the next day.
Correct.
Anything else that they could do after the procedure?
So after we do the procedure, we put the patient back on the blood thinners, usually for 6 weeks.
Okay.
And then afterwards, they will need more imaging to make sure that the device is sitting well in the left atrial appendage. There is no complication there. And then they keep following with their cardiologists afterward. And there is a whole protocol for that.
Very good. And what should patients do if they think they might be a good candidate for this procedure?
So they should reach out to their cardiologist to discuss that option. Not everybody's candidate for that, so they just need to, discuss it with their physician, and just to weigh the benefit and risk.
Very good. Dr. Kadri, anything else you want to add?
Well, thank you so much for having me. Appreciate it.
Of course, this is a great topic, important topic as well.
Absolutely.
All right.
Absolutely. Thank you.
Yes, you're welcome. If you want any additional information on today's topic, head over to the hot links page on our website, WNEM.com.